Once that inner liner has been removed, and then the vein sort of gets sticky and it closes shut, and then you have to maintain it shut for at least 2 weeks with compression.
People with significant varicose veins, like Jesse, have no choice but to seek treatment. That's not the case for people with smaller spider veins. For them, it's a matter of vanity, not health. But now, there are 2 new high-tech treatments that offer the chance to make those unsightly veins vanish.
Place the palms forward toward me.
Rima Singer was excited about a painless way to get rid of the multitude of embarrassing tiny leg veins.
They're not life-threatening. They don't impact my life in any other way, but I think they're just very ugly.
California dermatologist Dr. Mitchell Goldman pioneered the use of a device called the PhotoDerm, now gaining popularity across the country. The PhotoDerm is not a laser, but an intense light source.
We know that we can get rid of 90 to 95% of all the veins out there with traditional techniques of surgery and sclerotherapy. But there are so many patients that want their legs to be flawless. And the only way you can get them flawless is with these newer technologies like the PhotoDerm.
This was Rima's 3rd treatment with PhotoDerm.
There's just a little bit of a feeling of a snap against the skin, as if you were snapping a rubber band against the skin. Here, I can just get up and that's it.
Dr. Goldman says the majority of his patients have gotten a very good result from this technique.
Some people may feel a facelift is very important to them. I don't feel that way. This bothered me. My face doesn't.
Dr. Eric Bernstein, a dermatologist at Philadelphia's Thomas Jefferson University, has led a study of another high-tech tool for the treatment of spider veins. ScleroLaser went on the market in February. Dr. Bernstein says the ScleroLaser is not a light source, but a true laser.
We use a specific wavelength of light that's absorbed by the blood vessel, so the surrounding tissue is not really affected. Thus, you don't get a scar.
For Philadelphia resident Kristen Lorenz, the idea of zapping the veins away was very appealing.
It's a tingling sensation. If you have a fear of a needle prick, it's a little bit different than that. Just accommodate very quickly to that sensation.
ScleroLaser has been so effective for Kristen that during this 2nd session, Dr. Bernstein had very little work to do.
We had to get out the original pictures because we couldn't find, exactly where the first area was. So that was great.
Doctors say the number of varicose vein cases are on the increase, possibly due to more sophisticated diagnostic methods, as well as the growing number of aging baby boomers obsessed with youth and beauty.
Justice for all.
Sister Carol says her experience should convince skeptics that this disease should not be dismissed lightly.
If I did not have it done, I probably would be in a wheelchair. It's liberated me in a way that I can be much more active with the children. It's just great.
With the rapid advances in technology, doctors say they may soon be able to halt the disabling effects of varicose veins and eliminate spider veins permanently. Meanwhile, the American fascination with great-looking legs will probably never go out of style.
Dr. Timothy Johnson joins us now from Boston. Tim, does the laser or the PhotoDerm, now do they work as well with the big veins or only with the small spider veins?
They're really designed for the very small ones when you're looking mostly for a cosmetic result. The traditional surgery, vein stripping, and sclerotherapy have to be reserved for the big veins. They're the only techniques that really can help those great big ones.
Now, what about these vein clinics? So many of them seem to be advertising.
It makes the experts nervous because they tend to focus on one technique narrowly. They sometimes seem to miss the broad picture or underlying medical problems. So the experts we've talked with feel much more comfortable with people going to a doctor or a hospital that really takes a broad view of the varicose vein problem.
Well, an awful lot of people are interested in this. Thank you, Tim. We appreciate your bringing us this report, and we'll be right back.